So, good morning, everyone. My name is Carlota Silva, and I'm very happy to be here presenting the increasing uptake of HIV testing in the Caribbean. So as you know, we did tremendous progress on the HIV testing as well. So there was an initially slow start to end up in this steep increase, and we are now with 86% of people living with HIV diagnosed, among others. So we have a lot of HTS options, we have differentiated service delivery, we have decentralization that all help to achieve success. But still, we do have gaps. And the gaps mean that there will be additional costs for the testing to reach those that are not reached yet. And so we need really to focus and rationalize the core of the additional testing. And this is what I'm here to talk about. So I understand that you've been already into the cascade. I'm not going to say much more about this, just that the Caribbean has made amazing progress. But as you see, the trend of new infections globally, 39%, while in the Caribbean, 22% of decline of new infections. And especially in the last 5 years, there hasn't been much progress. And so who are we missing? I think 47% of the new cases are still key populations. So this is really crucial because we know that there are still high barriers of services, and we need to find delivery models for KP specifically. So at WHO, we see really HIV testing not only to test and treat, but to test and prevent. Basically, we really want to maintain people that are negative, and we want to offer those at risk prevention services. So the same mindset we have for treatment, we need to adopt and ensure that we have it for prevention to maintain the people negative with prevention or positive with treatment, and retain them both on the prevention and on treatment. So we think about the different HTS approaches must be adapted for each context and depends really on the epidemics, on the population, and this has to be discussed. But we need always not only to consider the testing component, we need to think about how to mobilize, how to create demand. And this really comes when, where, who, what does that services. On the service, on the testing itself, where should it be implemented, by whom, at what time of the day? But then we cannot forget the linkage to the services, and not only for treatment, but for prevention as well. So what are the priority for the Caribbean? We always need to think about the critical enablers. So the 5 C's that we know very well, all of us, we need to reinforce here, and this is globally, that U equals U, undiagnosed, undetectable. So this needs to be reinforced with the latest information, and many times we don't see this in many of the contexts. And besides all those listed, I would highlight the importance of the quality rapid HIV testing prioritization. So we really would like same-day results and linkage. And for this, we must have the lay provider testing and the task sharing. So why U equals U is important, why lay provider is important, why rapid diagnostic is important. U equal U's, we know it increased the uptake of HIV testing, and there are studies showing even 60%. We know that especially key populations, they prefer rapid diagnostic testing than lab-based methods, and they also prefer lay providers and specifically peer educators. So there's a lot of evidence out there providing the evidence for this. We know that using lay providers is also less costly and more feasible across the sites, and using rapid tests is also less costly and is shown to be cost saving compared with lab. So a lot of the viral load potentially being used to diagnose could be transferred to rapid diagnostic testings, for example. And we know that they provide rapid diagnostic testing, and lay providers provide accurate diagnosis. And finally, we are able to have a same day start. So we know that rapid tests have much faster turnaround time, and we know it enables PrEP and ART to start on the same day. And to reach the key population, it allows us to decentralize to the communities, which we know it's key to reach the ones, the last mile of the ones that we haven't reached yet. WHO has recommendations on preventing misdiagnoses that are quite important, especially for countries that are adopting the rapid diagnostic testing for implementation. So we know that there's a need to transition to a 3 testing strategy. So this means that an HIV positive diagnosis is made based on 3 consecutive HIV reactive results. And this is quite important, as we know that the treatment-adjusted HIV prevalence is decreasing. So the use of the 3 tests in the right order can increase the positive predictive value. And this is quite relevant in all contexts, even in high burden settings, we are recommending. So this is really all the settings we are now recommending this. We know also, besides the 3 testing strategy, that retesting before ART initiation is important, and we need to institute strong quality management systems. And then we have all these population that needs retesting. So we need also some innovation to reach those that are more difficult to reach. And we know there's a lot of evidence showing that virtual interventions are quite well succeeded, specifically in Asia, but also in the Americas. We know it's a critical way to deliver demand creation, including the testing service, the post-testing counseling, and the linkage through videos, websites, social media. We know this works. Peer educators as well. We know expands reach. We know specifically for key populations, this is a key intervention that really help us to reach the ones we need. And then we need to think what I've told before, that we need to think on a strategic mix of HITS approaches, such as facility, community, through partner services, or through self-testing. So what is new in the WHO recommendation? WHO launched 2024 guidelines on testing, and it recommends network-based testing services that includes already recommended that, but it includes partner services, family or household testing services, and social network testing services. The partner services are extended really now to STIs and Hep C, and social network testing is recommended for all people with risk. Before we were focusing more on key populations, now we are really broadening for all people at risks. And we have here on the right side a table on how to optimize social network testing. We know that self-tests can really increase the uptake and linkage. We know that we can, if resources are available, we can use multiple rounds to be more effective. We know that there's no need of incentives. So there's a lot of recommendations on this network-based testing that you can find in the guidelines. And we have a toolkit that is in development and will be released in early 2025. Still, provider-assisted partner services, it's still one of the most effective strategies and should not be neglected. On self-testing, we know that now it's recommended across conditions and diseases. We have Hep C testing, syphilis testing besides HIV self-test. We now recommend HIV self-tests at health facilities, so complementing the existing provider HIV testing and replacing also risk-based screening tools that we know that many times can miss the people living with HIV that are still undiagnosed. So this is quite been well taken in many other contexts. So, and then we have the recommendations for PEP and for PrEP. So for PEP, we know that for initiation and for completion, the use of HIV self-test is recommended. And for PrEP, and we're talking about oral and the ring, we can use self-test for initiation, reinitiation, and continuation. I'll go in another slides more in detail on this. And then for sure, the syphilis self-test that we mentioned, including the dual syphilis self-test. So I will leave this presentation behind so that you can see that there's so much evidence on the self-testing. And we do have a lot of evidence on specifically for key pops that can help on showing how self-test really improves the uptake frequency and positivity without causing any harm. So why do we want to reinforce the HIV self-testing for PrEP? Because we always think it's separate, but actually it's quite, it can go together very well, because we always think that a person's PrEP journey is quite easy. No, you start PrEP, you do the refills, you stay on PrEP negative forever, and all goes well. But in practice, it's a bit more complicated. So sometimes people miss those pills, they can't make it to the clinic, they access service when they can, their risk period changes and they stop PrEP for some time and they want to restart. So we need to simplify and differentiate PrEP service delivery. And this we need to accommodate people's complex lives. And we know that we have high targets for PrEP and that we are not reaching those targets. And the Caribbean region is not an exception. So HIV self-testing can really be a major game changer. And here again, we see the regions that are a little behind on HIV self-testing. And this, we think it's really a priority to try to close this gap and address this. So in conclusions, for the Caribbean, what I would say is that we need to create an enabling environment for HTS. This is a priority, and this, again, task shifting, either through lay providers, rapid diagnosing testing, the use of self-test. We need really to address the complex HTS algorithms and be able to reach those in need and really be able to decentralize and access the ones that we are not yet reaching. We need to accelerate the adoption of innovation strategies for HTS. HIV self-testing and PrEP would be a priority for scale up. We have a lot of virtual services that can be opportunities to adopt in this context. And then we need to continue to think about a strategic HTS approach. So it's not that one size fits all, but a strategic mix of a patient-centered approach for both mobilization, testing services, and linkage. And finally, we need to engage communities. We need to make sure that key pops are leading the services. We need ongoing monitoring, and we need them engaged to make sure that that our programs are successful. So thank you so much for this presentation. I'll be looking forward for more discussions.